Welcome to the second episode of the latest series of our Genomics Now podcast. This is our A Genomics Conversation with series, which is recorded in 2025. I'm Dr Fiona Calvert, the Comms and Engagement Lead for the North Thames Genomic Medicine Service. If you listen to our first episode, you will know that A Genomics Conversation with will focus on the power that open conversations hold in genomic medicine, whether that be in communities, between healthcare professionals, or with families. Today's episode is a little different. The audio comes from a wider conversation that actually sparked the idea for this series. In March 2025, we held our annual Genomics Showcase, and one of the sessions was co-produced by our patient, public, and carer panel. The session was titled, "What I Want My Healthcare Professionals to Know About Genomics." And today's podcast is a short snippet of the early part of this session. In the episode, you will hear a conversation between myself, our genetic counselling lead, and two amazing parents, Amber and Harri. Before the episode starts, please note that the conversation does include discussions around the loss of a child. It's a conversation held with care and compassion, but we know it's a hard subject for many, so you may wish to skip this episode.
Thank you. My name is Amber, and I've been part of the patient parent-carer panel, it's a bit of a mouthful, for about 2-3 years, I think. I came to be a member because I'm Freddie's mum. Freddie had Dravet syndrome, which is a rare genetic epilepsy. He would be 9 next week, and he died when he was 1. We had a huge learning curve to, I suppose, kind of get our head around his genetics at the same time as losing him, because his testing arrived too late to help him to control his epilepsy, and he died suddenly in 2017. So that is why I'm here, and I like to be able to say that I'm Freddie's mum. When you have lost a child, one of the things that becomes really precious is the opportunity to be able to take your child with you into other days, other years. And as we approach 8 years without him, it's very special to me to be able to bring him with me and share him with you and what I've learned and why I'm here. So, so that's me.
So I'm Harri. I am Eddie's mum, and that made me rather emotional because it's one that we've never met before. So I have the privilege of taking my son into the next day. So Eddie's up there. He is 10 now, but my experience with genetic testing came when Eddie was diagnosed at age 6 with T-cell acute lymphoblastic leukemia. Forgive me for any emotions. I think that intro certainly touched me, and also we're only 8 months post-treatment. So whilst Eddie is, as you can see, looking amazing, it's still all very raw, but that's my experience with genetic testing.
Thank you so much for sharing that, and I appreciate that quite a lot of the conversation may be a little bit emotive, and that's okay. That's okay. I'm Pooja Dasani, and I am a genetic counsellor. I'm a clinical genetic counsellor, but I also work as genomic counselling lead for North Thames GMS. And I am so privileged that you've asked me to join you here today. Being a part of your story, really want to listen to that story, share that with everyone, and if there's anything I can do to translate a little bit of that genetics, which is what I do day to day, that's what I'd like to do here today, and also share my experience in clinic.
Perfect. Thank you so much,
both of you for joining us, and Pooja too. So as you kind of have both alluded to, we know that when you're first introduced to genetic testing, that often comes at a really kind of complex time as part of a really unexpected healthcare journey. And I sort of wanted to ask, do you remember how the topic was first mentioned to you? And do you have any advice to kind of healthcare professionals in our audience about how to start those discussions with families during what is a really complicated time? Amber, I'll come to you first.
I think that my first conversation about testing was with a very noisy 7-month-old on my knee, throwing things around, being grizzly and upset, and it being actually quite difficult to have two trains of thought, one on his needs and one on actually hearing what I was being told. There's a difference between, I guess, kind of hearing and actually being able to listen. And I'm sure it's something that, anyone will recognise where you're speaking to parents, particularly with kids in the room, especially when, they are literally in arms. I felt that it was very disjointed, and even though I asked questions, which retrospectively I'm pretty proud of the questions I asked, actually, I felt like there was a reticence to answer the questions because it was as if there wouldn't be enough time because all of this was going on, and I mean a kid in a paediatric clinic, and I guess, it has never sat quite right with me that was our first conversation. Not only was it our first conversation, but we were sent for a blood test 3 minutes later. And I still have the sticker that Freddie was given that said, "I'm brave," on a picture in our hallway. It's fallen off a few times in the intervening years, but it was really memorable because we really didn't know what we were doing. I know that our situation isn't typical. I know that you would all want to hear that people are sat down and it's calm and quiet and there's a beginning of a conversation and a middle and an end, and that all of the things that you have in your minds as a checklist to convey, to do it properly, are done, but that isn't always possible. And I'm going to kind of skip forward to the night that we took Freddie into hospital, that Freddie was taken into hospital after we had found him. He had a cardiac arrest, and because he's thought to have had a seizure that we didn't see, that was very, very prolonged, and he was taken into hospital, and he was there for not quite 2 days, and it was never going to be anything but a catastrophic scenario for him from the minute we found him. But I'm skipping forward because I distinctly remember, I would remember this. I just wanted to share that we were standing in Royal London A&E with, kind of lots of things happening all around us, lots of bleeping, Freddie being resuscitated again. And the A&E doctor managed to convey, in a very panicked situation, with a clearly that was going downhill, with such clarity. I'm not saying it was, again, the way they would have wanted to have the conversation, but the conversation was not good. It was not a good conversation, but the way that doctor managed to say what was happening, what probably was going to happen, and what they were doing was said with depth and kindness, but absolute clarity despite the unknowns. So the fact that there was no known what's happened, it was said. And it's always been something to me that we can have that first conversation, which was confusing and too full of words, and kind of not giving us as parents the opportunity to really be spoken to as if we would understand, actually minimizing that we could have the capacity to understand, all the way through to that last sort of kind of few days where the information, it's a totally different scenario, I know, but I guess what I wanted to highlight was it's possible to speak about difficult things to people who are hugely invested in a patient or about yourself without things being dumbed down, even if you don't know the answers.
Yeah.
It was a long answer.
No, that was perfect. Pooja, I don't know if you want to come into that, around that concept of, I think that feeling that clinicians have around, I need to dumb this, and I hate the phrase, and I put it in speech marks all the time because I hate it, dumb things down, and actually what that does for that communication.
Yeah, that's such an important learning point, isn't it? And actually, what you've just tried to convey, I know that must have been rather hard to kind of think that through and relive that for a moment. But what you've managed to convey is actually the simple fact that we think about genomics as such a difficult conversation, right? We use the word genetics and genomics loosely, but in reality, we think it's so complicated. We're terrified of how we're going to use those terms and how we're going to simplify those terms. And do we understand it enough to do that? But actually, what you're saying is take the patients along that journey. And it's okay if we're not entirely sure what we're really saying, but actually listen and be a part of that conversation and be upfront and just say, this is where I'm at. It's, it may be that it's uncertain, but this is what I'm hoping to get to at the end of it, and not be bogged down in all the terminology and all the big words and terrifying conversations that we find every day. I hope that kind of represents what you were trying to say.
Absolutely, yeah. It puts it into much kind of, it's just listening, and the fact that the uncertainty, it's okay for there to be uncertainty, it doesn't have to be a kind of walking away from a room with everything, and that there's a door open to come back, actually, and whether that is practical signposting or another appointment, or what will happen. Yeah,
that's really important, isn't it? We get really worried about, actually, we need to get everything across in one moment, and that's all we've got. And of course we do, because we're busy clinicians. But knowing that some things just need to be staged and you've got somewhere to go with those questions is so important. It's a big learning point.
Yeah, thank you so much. Harri, I don't know if you want to give a little bit of info on how you were introduced to genomics.
Yeah, so I think although this is not my viewpoint, I understand that there are a few reasons why patients may not want to be genetically tested. And one of those reasons is fear of what it might say. So I think you as healthcare professionals really need to understand that and start those discussions with that in mind. And I think really also one of the things I have been thinking about is it goes beyond just that conversation, because it's all the conversations you've had before that as well with the patient up until that point. And I say that because if you've established yourself as part of this patient's team, and I'm not talking about a medical team right now, I'm talking about their team, a personal level, I think if you've done that from the very beginning, then anything you say from there is going to be trusted and taken in good faith. And I think that's a really important thing. It's not just about that one discussion, it's about every discussion you've had so far with that patient. And I think also it's really important to say that you just need to be mindful that the world, as many patients have known it, has just been blown to smithereens. And, you know, they're being asked to make 100 decisions and digest a lot of information in that moment. So it's just about being really mindful of that. And actually, I agree with you completely. You know, don't think you have to dumb it down so much. But equally, I actually think it's also important to make it as simple as possible. So it's about finding that balance between the two, really. So I think if I was to go back to the conversation again, and actually this is sort of how the conversation went. So I had a conversation with our consultant, and he sort of mentioned it to me a little bit in passing, but I have to say I was very quick to be, you know, I think I've written down here, if my consultant or any of our medical team had asked me to sign a form sending Eddie to the moon for better diagnosis, in that moment, I would have signed it. So I was very much on board. But I think the most important thing is to say that you think it's important and why you think it's important. If you know those two things and you've established yourself as someone they trust, that's all that matters, because then as you say, you can keep that door open. And sometimes it takes a moment for families to digest as well. You know, that's a big thing. It's probably something they've never even had to think about before in their lives. And so it may well be that's the only conversation they need. And obviously you can be led by them, but it might be that later on other questions come out.
Yeah. Can I just say, I think that distinction between being simple and clear versus, you know, thinking that you need to dumb something that is different.
Yes.
It's a different concept. We're not talking about being simple and clear doesn't mean treat me like I don't understand.
Exactly.
Pooja, I don't know if that's something you experience in clinic and how you work with families.
Absolutely. I think I have to say that team approach, that's incredible, actually. That's really sat somewhere with me, and I'm going to take that with me, actually, because that is such an important distinction between patient and the clinician, but actually we're in it together, and that is so important. So I think that's my learning for the day. But yes, so simple communication, I think that communication complexity, I think we certainly think about good communication as, right, I've got to really simplify this. I've got to make it very, very, very easy to understand. And that's true, but it doesn't have to be, exactly as you say, it doesn't have to be at the, let's dumb this conversation down. It just needs to make sense to that individual. And that can be in many, many formats. It could just be, you know, we in genetic counseling, we use a lot of metaphors. And that's a good thing and that's a bad thing, because some metaphors really don't sit well. You think is making sense and it really doesn't, because if that's not people's understanding of the world, it's not going to make sense. But we always like to try different things. So we'll draw things out and we'll kind of show pictures to see if that makes any sense. And I think it's just kind of being open to say, actually, if this isn't working and it's not clear, let me try something else. Let me make sure that we're in this together and you are able to understand it. And also opening that conversation the other way to say, you feel comfortable enough to say, I don't get this. Tell me more.
I just wanted to come back on something you said there around, you know, sometimes, and I think we've probably all done it in our professional lives, you go in to have a conversation that you know is going to be a hard one, and you come away and you go, I'm not sure if that landed. How would you feel if a healthcare professional kind of not necessarily said it to you in that phrase, but said to you, you know, do you feel like you've got what you needed from this conversation? Is that something that you would appreciate?
Yes. I mean, simple example that happened this morning. I've got 2 5-year-olds, and I said, I'm coming out today and I'm going to talk to lots of people about Freddie. And I said, there's so many people here and there'll be so many people online. And I said, their answer to me was, oh, Mummy, you're going to be there all night. Because their interpretation of me talking to you all would be one by one. That was a viewpoint from a 5-year-old. Now, we all know we're having a collective conversation, but it's a good point to that people hear things in different ways, and I thought that they would. In my head, it was perfectly obvious that it was going to be a group of people, but they had an idea that somehow we were going to be doing a wedding lineup and I was going to be talking to you all individually, exactly. And I think that, so yes, absolutely yes. I think that team approach is a really helpful way of putting it, because you want to kind of perhaps feel that patients go away feeling like you're on their side. No, obviously you're on their side, but that very simple kind of human, how does that sound? I actually think how did that land is okay, but even just how did that sound? Because you don't know what they heard or what they didn't hear. Because a lot of what is shared, you pick up on a couple of words, maybe, and then you put them together. And if that sentence that you put together when you go home is not what you wanted us to hear, then that's where the misunderstandings and the, kind of the wiggliness of this journey kind of comes in, because, the signposting, the charities, the leaflets, if you get them, I didn't, but if you get them, you've got black and white things to read, but just a simple, how did that sound, I think is, So I've made that far more complicated than it needed to be.
No, not at all.
Yes.
I think also you're right, the signposting, at the end, because I think people do have a tendency to be aware that your time is precious. So we're all there. You guys are there trying to get to the next appointment. We're there being really conscious that we're taking up your time. And so signposting and saying, this is not your only opportunity to ask questions. Go home, digest, have a think. If you need to come back to me, do. Because I'm not sure actually all of us as patients will do that. We'll be concerned that we're, taking up too much of your time. Having said that, I would have done anything for my son. So I would, poor Dr. Bartram probably had 700 emails from me a day.
As you can tell from just this small snippet, the conversation in the room was exceptionally powerful and important. You can watch the full conversation by heading to our YouTube channel and searching for North Thames Genomics Showcase 2025 Session 2. We'll also pop a link to the video at the end of the episode description. In the full conversation, you can hear Amber and Harri talk about data concerns, the power of language, and being comfortable with, I don't know. Thank you again for listening to this episode of our A Genomics Conversation With series. Keep an eye out on our channel for future episodes and head to our website or LinkedIn channel for more genomics content. Just search for North Thames Genomic Medicine Service.